In part 3, we will look at various bioethical issues and some associated examples. When it comes to alternative reproductive methods such as in vitro fertilization, there are a lot of bioethical issues that surrounds this topic. One such issue is going to be pre-implantation genetic diagnosis. This is going to be when an embryo is formed in vitro in a test tube setting. There could be certain diagnostic tests could be run to make sure that the genetic components are all well. This could even be taken a step further to see if a designer baby could be produced to try to help even with a ill sibling. And if it's not the right component needed, that embryo could be destroyed. This is a very controversial topic because individuals might consider this as playing God when it comes to the physicians or the parents. There could be various other aspects to this as well. Say, knowing in the family if there's a certain genetic disorder, if an embryo is formed even in an in vitro setting, that could be tested to see whether that particular disorder is contained and whether to further that or choosing the embryos. So there are many different ethical considerations that come into this type of a case. This also brings us to the concept of stem cells. These are the cells that are there, which also could be considered starter cells. They could be developed into various body tissue types. If this is used even in the stage of an egg or an embryo, this also could bring up the concept of cloning, how you can reproduce a certain cell, a certain organism. Or else this also could be just used for therapeutic reasons. There are two major types of cloning: reproductive cloning, where you can clone a baby. Therapeutic cloning is you use the same process but to help repair certain damaged tissue or so of some sort of a somatic cell line type of thing. And both these aspects will have certain ethical considerations. Again, the question of are we playing God in terms of creating humans or manipulating the process, or should this only happen only through a procreation in the natural process? And again, genetic testing can be a very good tool in certain cases, but it also raises a lot of bioethical types of concerns, because now, not only in babies and the decisions that you need to make, if genetic testing is done even among individuals, now if that information is obtained by the employers, can they discriminate against the employers for certain disorders, certain types of things, and who's going to regulate that information? That's going to be another consideration that needs to be think of as well. And what if these genetic tests are not accurate? If there are certain errors and decisions are made based on that testing, and who's going to be responsible for that? And this also brings us to the concept or the issue of end of life care. If individuals are terminal, if the patients are terminal, what about ending their line, even for humane reasons? Euthanasia or physician-assisted suicide, like helping voluntary or involuntary to end one person's life with the hopes of helping to end any suffering that the patient is going through. What about those types of things? Even for euthanasia, these are going to be, euthanasia is a physician helping in the life of a patient. So that's a direct way of the process happening. This could be voluntary or non-voluntary. Voluntary is if the patient requests it. Non-voluntary if the patient is incompetent, cannot make those decisions, and usually requests made by the family. And then we have physician-assisted suicide. This is the concept of the physician helping the patient to end the patient's life, possibly through some prescription medication or something. So that's the difference between euthanasia, which means the physician directly acts, physician-assisted suicide, is where the physician empowers the patient to end the patient's life. Physician-assisted suicide or even euthanasia is illegal in most states. There are a few states including Oregon, Washington, Vermont, and California. There are certain laws, there are certain regulations that allow this process. There is the Death with Dignity Act that has been passed and been adapted across these different states, where they have allowed physicians to aid in this process to help looking at the humane aspect, the dignity aspect of the patient to help them in this process. Most of the time what happens is when patients are going through a terminal illness, they feel they are a burden to their family, they feel like there is no end to this, or maybe even to help reduce or to put a stop to the pain and the suffering they're going through, they might want to end their life, and this is also another ethical consideration. Who determines these things? Who is going to regulate these processes? And is this even ethical to take the life of someone else? Because one of the mandates for physicians is to help patients do not do any harm. Is this going to be considered something as a harm, or is this actually helping the patient? This also brings us to the concept of advance directives. So these are legal documents that patients provide to their healthcare providers that would give specific instructions to act during certain situations. This is done in advance so that if the patient is incompetent to make the decisions, if the patient in a certain way where they cannot communicate with the physician, in those cases this will be there in place even before that, so that the physicians could work according to these directives. An example for this is a DNR, do not resuscitate. Resuscitation meaning if a patient stops breathing by giving artificial breaths or doing CPR, that type of thing. So any efforts, if a patient says, no, I don't want that, an advance directive can help the physicians make the call and say, okay, we don't have to do that because that's the will of the patient. And these are also going to be important when it comes to some of these decisions that need to be made. Another big topic on bioethical issues is the topic of transplantation, organ transplantation. So this is the process of using an organ from one individual to help with a disease or a sickness in another individual. Uh, there are several different types of ethical and legal issues that comes into this because it involves two individuals. One person is the beneficiary, the other person could be someone who is either recently deceased, or there could be a living donor. And there are certain things that needs to be considered, whether there is financial reimbursement. It can happen, it can even result in a black market for buying these types of organs. And even when there are donors, who will get the organ is another concern that needs to be considered. Since 1984, there has been the National Organ Transplant Act has made it illegal to buy or sell any organs in the United States. So it's a very regulated process. Organ donation can happen, but there is a waiting list that needs to happen, and this has resulted in several individuals who have died due to the lack of available organs. It's not very easy when it comes to this process because there's a lot of medical matching that needs to be done as well, but this also has created a black market to try to obtain certain organs for recipients who need them. One of the largest organs that is usually transplanted and donated are kidneys. And even when it comes to kidneys, there are several thousand individuals that end up dying annually without or waiting for the transplant to happen. So there are several organizations that help in this process in terms of having the appropriate wait list, assigning priorities, and coming up with certain protocols in terms of who gets the organs, how they are being matched. For different organ types, there are different criteria. Say, for example, if it's heart transplantation, the patients with the highest need will have the highest priority. Say, if somebody's on life support or intensive care, they will get high priority. When it comes to kidneys, it's based on a points system, and whoever who has the highest points will be the next person on the transplant list. If it's the liver transplantation, there will be certain guidelines on alcohol abuse and what criteria they need to meet before they can qualify. And also, this has to be a process of decision between the family, the patient. Everybody has to give some consent, and all the components need to be in place, even to be able to harvest organs when it comes in the United States. Uh, However, when it comes to families, they have a huge concern when it comes to organ harvesting because the media has sensationalized this about illegal buying and selling of organ and behavior of physicians, and that sometimes even tends to make families more reluctant in granting permission. In other parts of the world, in other countries, uh, there is a presumed consent, meaning if the patient does not actively oppose to transplantation in the event of the death of a patient, it is automatically assumed that organ donation, organ transplantation, or harvesting could happen. In the United States, it's the opposite. Consent needs to be actively received first from the patient and then from the family before this could be processed. So this also brings into certain ethical policies on how is the family going to consent to the organ donation. Are there certain guidelines in this process, and even when the family is going through grief after the loss of their loved one, how can they make these types of decisions? And there are certain considerations that needs to be made. Organ transplantation also can happen between close families because it's more compatible, less chance of rejection, but this also put pressure on the family members to try to agree for the organ donation. Say, for example, donating a kidney to a loved one or a family member, they match well, but then it puts pressure on the person to try to help, and those types of issues can cause bioethical issues also. And then we also get to the concept of living donors of when it comes to organ transplantation. This is again, it's going to be the agreement, the interaction between two individuals, and how do they decide, okay, how this process needs to be done. And this is something that's usually been encouraged in the United States when it comes to donation of organ or marrow. And even there are certain tax incentives. Is it ethical to have some sort of measures like this, even to even encourage this type of process? So those are things that we need to consider when we're looking at this specific field of organ donation and transplantation. So since there is a high need for organ recipients, there is also this blood market, and that could be developed even in other countries. The World Health Organization estimates that over 10,000 illegal organs are purchased worldwide annually. And this is only a conservative estimate. Are they done, see what are the medical procedures? Are they killing people in this process? Are they from deceased individuals? So there are a lot of things that needs to be considered when you're looking into this. And also the concept of whom are these organs being obtained from. It is illegal or it is not proper to use poor individuals, vulnerable individuals to harvest organs. But what are the measures, what are the protective measures that could be put in place to try to even avoid this type of behavior? Even if there is an informed consent, informed choice, what are the measures that could be used to try to avoid one individual taking advantage of the other? And then finally, we also come to the concept of xenotransplantation. This is the transplantation between different species. since there's a shortage in human organs available for donation, there could be xenotransplantation for certain procedures that could be used from animals that avoids the killing or even addresses the shortage of human organs. But now there are ethical considerations. It's okay, is it the same for killing animals for food, killing animals for organ transplantation, or for experimental procedures? Things that need to be addressed with this also. So when it comes to, again, the concept of organ transplantation or different issues related to that, we see that there are several restrictions in the United States. Even when it comes to the shortage, there are certain processes or certain organizations that help individuals go to different countries, like medical tourism, and have these types of procedures done. These have been planned, these are coordinated, even when it comes to the expense. If someone was to do the procedures here in the United States versus another country, that would be much less expensive. There are consideration, is this ethical to go somewhere else and use organs from a different country? Is there certain abuses that are involved? Things that needs to be considered in this industry and in this part of healthcare. So, final thoughts. We were looking at the different types of ethical considerations that are involved in healthcare. We looked at a few different flavors. This lecture is not comprehensive, but we took certain aspects, looked at workplace issues, certain models that are in place, and even bioethics and some examples we looked at. We looked at the medical ethics versus bioethics and how the use of technology is also a central focus when it comes to healthcare. And ethics is again important because we are now dealing with several entities that have different perspectives and how they work to solve certain concerns to come to like a common solution.